Health officials are recommending that getting a flu shot now is critical, especially due to a fairly mild flu season last year due to safeguards in place because of COVID. On this edition of Health Check 360, Tomah Health infection prevention practitioner and registered nurse Candi Newlun explains what you should be doing to prepare for this year's flu season. Flu season. Oh my God, it's not the fleas. Those are cats and you know, I think we just had Ruby.
We don't want those either. Yeah, no.
We don't want fleas, but the flu season.
The flu season.
So, Candi, can you just start us off with how are people getting the flu? Like and maybe what symptoms maybe they should be looking at to they know they're getting the flu?
Yeah, absolutely. So when an infected person with the flu is out and about other people and they cough or they sneeze, droplets from their nose and their mouth go into the air. And a person that is well, even, you know, healthy and doesn't have any medical conditions or anything, can breathe in those droplets and they can become ill. They can pick them up off of surfaces. So when those droplets come into the air and they drop down onto your table, your coffee cup, your chair, you touch them with your hands, and then you touch what we call a triangle here, which is your eyes, nose, and mouth. You can infect yourself. So it's not very hard to pick up.
Is that why washing hands is like, I see signs everywhere, wash your hands to prevent flu, and everywhere, schools, public places, yeah.
Absolutely. Hand hygiene is an infection preventionist go-to. They will tell you all the time that hand washing is your best defense to keeping yourself healthy. You want to wash your hands before you eat. You want to wash your hands after you touch items that other people have touched, you know, before you touch your face or anything like that. Hand washing is an excellent way to stay healthy.
Well, let's talk about why is it so important to get the flu vaccine?
Absolutely. Getting a flu vaccine is your best defense from getting the flu. Your body recognizes that there's a foreign material in your body because it's made antibodies that protect you once you get that flu vaccine. So, and if you protect yourself, you can protect the people around you. Especially if you've got people at home that are immunocompromised or that are very young, very old. Even healthy people, like I said, want to get that flu vaccine so that they can protect the people that they care about and the people that are out in the public.
And what best time is to get the flu? Do you get it in the early, the middle of the season? When's the best time to be making sure that you're getting that vaccine?
Well, actually, the CDC says as soon as they become available.
Okay.
But they suggest that you have it by the end of October.
And that's coming up, isn't it?
That's coming up
soon.
That's coming up. That doesn't mean it's the deadline, though.
Right.
So you just want to make sure you're getting that flu vaccine before the flu starts to spread in your community, because it does take time for the antibodies in your body to build up so that it can recognize that virus if it enters your body. And that takes about 2 weeks. So we actually started our flu vaccine clinics a little early this year. We started them in the beginning of September. The hospital is giving their employees the flu vaccines right now. Doctors' offices are. You want to get it in by October if you can, the end of October. But if you can't, that's okay. Go ahead and get it in November, December, and even if it's another point in the flu season, there's really no bad time to get it, but early is the best.
And who's at higher risk then of getting the flu versus somebody not getting the flu?
Anybody,
like our high-risk population.
Yeah. Younger people, you know, under 5 years old, people over 65, people that have chronic illnesses, asthma, lung disease, immunocompromised, they have cancers and stuff like that, that have trouble fighting off illnesses because their bodies are already ill.
Oh, okay. Because taking the extra energy and work. When you say
immunocompromised, people that have poor immune systems, poor ability to fight illness. Such as that. So people that are already fighting off illnesses, they're already compromised.
Like, would that maybe be somebody too that might be have cancer?
Yes.
And they're getting cancer treatments and
absolutely
something like that because their body's in the middle of something like that, or had a recent injury maybe.
Absolutely.
Even.
Absolutely. And even people that are not getting well hydrated, not having good rest, if we're always in a chronic stress situation, those will compromise people as well.
Sure, your cortisol levels are up high and your body's,
Absolutely. And the other population I didn't mention is pregnancy. Those are people that really want to get the flu vaccine as well. And, if they're pregnant now, it's in the October, they're in their 3rd trimester, this is still a great time for them to get vaccinated because that may pass some immunity onto their babies when they're born.
So how do I get a flu vaccine or a viewer?
Absolutely. You can call our Warren's Clinic. I do have the number right here. I don't have it memorized. 377-8792. They are available Monday through Friday from 9 a.m. to 6 p.m. You can just call and make an appointment. Otherwise, they can call the Monroe County Health Department. That number is 269-8666. You can make an appointment there to get the flu vaccine. And as well, there's some pharmacies around that will give flu vaccines if you call for an appointment. And then our website at the hospital, Tomah Health, has other information on how to get a hold of people to get flu vaccines. Or they can contact their regular providers.
Great. Any other words of advice for the flu before we go? We have about 30 seconds.
I just think it's really important right now, considering that we are in a pandemic, that we do our due diligence to keep ourselves healthy, get our flu vaccines, and protect the people around us so that we can minimize severity of illness. So that it might make a very big difference in somebody that's already having trouble.
Candi, thank you so much for joining us. It's great to have you on.
Thank you very much.
Thanks.